So as part of one of our evaluations or just ongoing quality audits, we determined that there was a concern that there had been an issue.
Some 1,800 children in the Upstate may need to be revaccinated after a mistake affecting 2 doctors' offices. Greenville Health System says some children may not have gotten full doses of some immunizations they received.
7 News reporter Ann Maxwell spoke to a doctor about exactly how this happened and what they're doing right now to fix this problem. So what did you find out, Ann?
Amy, Tom, the problem is affecting about 14% of patients at Greenville Health System's Pediatric Associates offices in Easley and Powdersville. Now those offices are offering to revaccinate children for free. The Centers for Disease Control recommends revaccination in cases like this to be safe. About 1,800 letters from the Greenville Health System went out to families this week, saying due to a human error, their child may not have received full doses of some vaccines.
We are just so apologetic for this inconvenience, and we've tried to do things to make this easier for the families to get in.
GHS is offering free revaccinations to those children during regular office hours, as well as during special after office hours and weekend clinics at the 2 practices affected, Pediatric Associates in Easley and Powdersville.
2 months of age.
Dr. Robin LaCroix, who's the medical director of the Children's Hospital, believes only a few children actually received insufficient dosing.
We wouldn't want any child to contract a vaccine-preventable disease, and so that was the reason that it was out of extreme caution that we really cast this very wide net to re-immunize these children.
GHS does not know of any patients who got sick because of the slip-up. Dr. LaCroix says she can't go into details about the human error that caused the issue because it's a personnel matter. However, a statement from GHS says the team member who provided the immunizations in question is no longer with the practice.
It's a wide range of ages and a wide range of vaccines
that were possibly affected.
Yes.
Dr. LaCroix says revaccinating these kids is safe, even if they received adequate dosages to begin with.
CDC has recommended if you can't verify and know that somebody has had adequate immunization protection, then you should just start over with them.
And in a statement to 7 News, a spokesperson from the Department of Health and Environmental Control says they are aware of the situation and they support GHS's efforts to ensure those children are up to date on their vaccines.
All right, so how do you figure out, how do these practices figure out who's on the list? I mean, that seems to be complicated.
It's a great question. Dr. LaCroix said that they went through the medical charts in detail, and if there was any question that they could be affected, they were on the list.
So they feel like they've got everybody that might be impacted by this. Ann, thank you.